Please let me know if the internet is fine.
क्या आपका बच्चा ऑटिज्म, एडीएचडी, डाउन सिंड्रोम, सेरिब्रल पॉल्सी जैसे किसी अवस्था से प्रभावित है? क्या आपको अपने बच्चे के विकास में किसी प्रकार की देरी नजर आ रही है या समय समय पर कुछ ऐसी बातें दिखाई देती है जो असामान्य हो? नई दिशा आपके लिए निशुल्क हेल्पलाइन एवं अन्य निशुल्क सेवाएं उपलब्ध कराती है। हमारी वेबसाइट nai-disha.org पर माता पिता अपने बच्चों के लिए पास के थेरेपिस्ट, स्पेशल एजुकेटर और अन्य प्रोफेशनल्स को ढूंढ सकते हैं जो हमारी सर्विस डायरेक्टरी में रजिस्टर्ड है।
Hi, Shabina.
Hello, doctor. Hello.
Sorry, I could not call you only later.
ऑटिज्म, एडीएचडी।
Hello everyone, welcome to our live session, and we'll wait for a while for more participants to join us, and then we will start in a while. Please be patient.
किसी अवस्था से प्रभावित है? क्या आपको अपने बच्चे के विकास में किसी प्रकार की देरी नजर आ रही है या समय समय पर कुछ ऐसी बातें दिखाई देती है जो असामान्य हो? नई दिशा आपके लिए निशुल्क हेल्पलाइन एवं अन्य निशुल्क सेवाएं उपलब्ध कराती है। हमारी वेबसाइट nai-disha.org पर माता पिता अपने बच्चों के लिए पास के थेरेपिस्ट, स्पेशल एजुकेटर और अन्य प्रोफेशनल्स को ढूंढ सकते हैं जो हमारी सर्विस डायरेक्टरी में रजिस्टर्ड है। माता पिता यहाँ अपने बच्चे की डायग्नोसिस के अनुसार या बच्चे के विकास और थेरेपी से जुड़ी गाइडेंस जैसी जानकारी भी आसानी से प्राप्त कर सकते हैं। आप 8448448996 पर कॉल करके अपने सवालों के जवाब और अन्य सेवाओं की भी जानकारी ले सकते हैं।
All right, I guess we can start now. So, hello and good evening to everyone again. सभी को नमस्कार और welcome इस live session में. Today we are joined with three very prominent experts, and they are very experienced in their own fields. And we are going to talk about two very important topics, which are open door and child protection policy. The whole topic is basically building a safe and collaborative space for parents, caregivers, therapy centers, professionals, and all of them to form a holistic approach towards intervention. Most of the parents and caregivers might have faced in their lives certain situations where they don't understand what is going on, maybe in the therapy centers with their children, or even professionals might have faced situations where they would not understand how a particular child has been brought up in their family. So it becomes really important to bridge that gap and bring all of the learnings together, so that the intervention that is happening and the impact of it can be at the best possible position. So let's meet all of our panelists. I'll start with Dr. Seema Lal. She has joined us today. She's a PhD and a professional who promotes child rights, especially with the lens of neurodiversity, and also she's a mental health advocate. Dr. Sana has also joined us today. She's a developmental pediatrician and has immense experience at coordinating intervention plans, evaluation, and assessment of child development. Sabina ma'am has also joined us. She's extremely experienced speech therapist and an autism interventionist with years of experience. She has also spent her years in academics. I guess that's an introduction to all of our panelists. We can start the session now. We'll start with understanding what actually is open door and child protection policies, and I hope along with caregivers there are professionals who have joined us today. So I'll start with this first question, and then we can take multiple opinions of all of our panelists one by one. We'll start with the question of how do open door and child protection policies function in a therapy setting, and what are their core objectives of it. So maybe Seema ma'am can start with that. The core objectives of open door and child protection policy, and how we can inculcate it in a therapy setting.
Thank you, Uncle, and thank you, Nayi Disha, for reiterating this topic again and again because it is important. It is about children, and it's great that Shabina and Dr. Sana are also here, so they are in the field and they can voice the practical difficulties of having an ideal policy can be great, but what happens in the ground level, it's great to know both sides. So open door basically is the primary objective, of course, is child safety. Because even as per the medical ethics is when you have a little child, when a doctor is checking, there is one other person who's always there. It's never only the child and the doctor who's examining the child. There is one other person, either the nurse or even if it's vaccination, the caregiver, somebody is there. So then why not the same with therapy when it's not like it's a quick injection or a surgery or anything. It is a 45 minutes to 1 hour therapy session which is ongoing with a little child. And this child, remember, a child with most often communication or comprehension or sensory issue. So there is a young vulnerable child and a completely trained adult therapist within a closed door is setting the ground for child safety issues. But having said that, this is not to paint the picture that, oh my God, our therapists and professionals, abusers. No, I am speaking as one among the therapists and professionals. So I might know I am not going to do anything to the child, but let us face it that abuse happens 99% from trusted adults. So our job as professionals and as parents is to watch out which are these settings which can probably perpetrate abuse and leaving the door open or transparency. And I don't mean literally the door open, which can also be, but basically a transparent approach where the parent has access to what is happening inside between the therapist and the child is necessary, mandatory, also as per law for child safety. That's the first reason, but there are several other reasons, but I guess I would love to listen to the others.
There's quite interesting points put on by Seema ma'am. I guess we can go ahead with Shabina ma'am, your opinions on how these policies can function in therapy settings.
Yeah, I think that this policy is very, very crucial and important. Way back, 20 years back when I passed out, therapists were not taught to have parents in the therapy session. And it was, it's probably 5 to 7 years new idea where the parents also participate the value right now of involving parents in the therapy session. There are many, many situations where you see the parents have such valuable inputs to give us. They have so much of the context in which the child is living, especially for communication and speech, which they have to offer for us, which is going to help us leverage on our therapy activities. So having a parent in the session is a very wonderful thing to happen. And definitely for safety purposes, for the child, and to leverage on your therapy activities and benefit from it because they're going to carry it on home. They're going to come with new ideas. Even today, I had a parent who gave me a new idea, and I said, "That's so good. That's so brilliant. Why didn't I think of it?" Like, it's such a simple thing, but you just gave me an idea. I'm going to use it for another parent, and I'm going to give this counsel to another parent. So I have learned more from the parents, I would say, rather than my own homework. Yeah. So that is my point of view too.
Yeah, I mean, quite interesting point because the parents are gonna stay with the child for say the whole of the day basically. It's 23 hours that the parents are staying with the child or the caregiver is staying with the child. So taking in the opinions and communicating while the therapy is going on, it's really jots down the points of core objectives of CPP and OTP. We would love to hear from you, Sana ma'am, your opinion and from your experiences.
Um, I agree to both what Seema and Shabina have said. It's absolutely wonderful to have parents in the session because that's what gives the value to the sessions, I think. And each session is so exciting to go to when you're listening to what's happening, and it's more collaborative. I think when we are going into a session with an open mind, we are not in the standpoint of the expert for the child, but we are in the shoes of expert in our subject, and the parent comes with the expertise about the child. So we are trying to meet somewhere in the middle, and it's really interesting to get so many inputs from parents and listen from them what their hopes and hopes are for coming to the session, or the ideas that they share. Or sometimes when we are not able to get through a certain point, they say no, try this, and then you try that and it works for you. So it's very really important for us to be in a partnership than in a hierarchy position, and from there is openings towards transparency. And in fact, research also says that the best outcomes are when a parent and professional work together. It is not from a standpoint of our opinion, but it comes from a standpoint of research, where basically the roots are in what we call family centered care, where we are trying to collaborate with families. And there is enough scientific research to show that family centered care works best for the families in terms of long term outcomes. Yeah.
Right. I mean, what you pointed out about family-centered care is really important, and I believe most of the professionals here abide by it. And I feel most of the times what happens is, on the contrary, most of the times therapy is seen as a transactional approach. I'm going there, I'm paying up some money, and I'm receiving something. And
Yeah.
moving away from it and bringing in the emotional aspect of therapy. There, on the contrary, again, there is the legal framework and legality of things. Most of the times, it happens that we know there is a child protection policy, but we don't know where it is on papers. So, if Seema, you can, elaborate on that, the legal frameworks behind these policies and how, you know, uh, professionals can ensure like transparency.
Yeah, regarding the legal framework, now this I speak not as a lawyer, but as an advocacy group that we have. There was no legal framework until 2016 is only when we had the rights for it became a right. Until then, it was like, yeah, if you want, you do it. It was not like a
Ah,
right. So that's only in 2016 when the law came in place. It's only in 2017 that it was mandated that every state in the country frames their rules, but which not many states didn't, including my own state, Kerala. In Kerala, the rules were framed in 2020. After we had to file a public interest litigation in our High Court here, and we led to the public interest litigation because when I was working as a therapist in therapy centers and moved out on my own, I had mothers coming and talking about abuse, as in child safety issues happening within private therapy centers in my city, Cochin. So, and nobody knew what to do because I like how Shabina very rightly said, I'm not trained in child protection. I didn't even know the law. I know there is a law. Who's reading that? My job is special educator psychology. I will do like how Dr. Sana said, we are subject experts and law is not our subject. So this is so disjoint. And when the mothers opened up, it's when the whole legal exploration even began and we realized there is no law, there is no policy, there is nothing. So then it took us 5 years of petitions where the family members, the mothers had to speak up, and I could only stay there as a support with immense media support, support of the lawyers. We got a policy in place. So in Kerala, there is a policy now which makes it illegal if the parent is seated outside and if it is only the child and the therapist inside. If for some reason the parent needs to be seated outside and the child alone is inside, it is mandatory that there has to be a CCTV or it is a one-way, screen, the glass wherein it is transparent and the parent has access. And the CCTV footage is supposed to be recorded and documented for minimum 3 years. Now, this is mandated by the law now in Kerala. Now, the RPWD Act, the Rights of Persons with Disability Act, also has a section where it talks about child safety, but it doesn't go deeper into therapy center regulatory guidelines per se, which is there in Kerala and many other states. Tamil Nadu, now I think even in Andhra Pradesh or Telangana, they are also, the talks have started, and I'm sure this can be replicated with additions and modification in each state depending on the context and cultural differences because India itself is so diverse with each state the issues are different, so it is possible, but again like Dr. Sana said, it has to be a collaborative approach to even frame that policy. It can't be some random people sitting there and making a policy, but it should include the voices of the parents and the professionals who are working in the field. So there is a policy. It is mandated by law. And we have the case in the Supreme Court also now, which by now most of the states have framed the rules. And all the states have district level committees also who are supposed to monitor this, that this is happening in these therapy centers. So the names of the district level committee members in every district in the country is supposed to be there in the social justice website. But again, the case is ongoing and we are at it. Legally, that's where we are with child safety. Yeah.
Right. I would like Shabina ma'am and Sana ma'am to point out to this discussion rightly as Seema ma'am pointed out about all the legalities and frameworks. I feel caregivers are, so we all know that there is a huge challenge of acceptance. When the diagnosis is done, there is a huge challenge of acceptance, and there is a certain amount of helplessness also which caregivers might feel. And at that juncture, how the legal frameworks are made, how empathetic in words those legalities are, it becomes really important. I feel Sana ma'am and Shabina ma'am, both of you can point out to that. How important it becomes for the legal frameworks also to be understanding about what the caregiver is going through. But I mean, it can be strict, obviously, but understanding the challenges that a caregiver goes through is also becomes important. I guess Sana ma'am, you can go ahead because Shabina ma'am's network has gone down, I guess.
Yeah, like Seema was just saying, I think it's important to have parents in every step of what we do, whether it's making guidelines together or making uh, not having parents together, and from the professional end, adding the science backup and why we are saying this, adding reasoning to that, which is meaningful and not from the point of an opinion. Because when you make something like a guideline or a legal framework, it's important to have a significant amount of uh, I think supportive information that has been existing over a period of time to be able to frame something like that. So a lot of information around what are the factors helping a family move forward in outcomes, and at the same time the individualness of families come out only through their voices. Every family will be different, their challenges will be different, their situations will be different. It is no one family will be like another, so then it's important to have their voices and add in their opinions depending on. And it also is in every family from different backgrounds, also having representation from such different groups can be also helpful in when you're making something that stands good for a larger population.
Correct.
So
Yeah.
I feel, yeah, that's having that representation is absolutely not there is no option. So we need to have that. Yeah.
I like the point where Sana ma'am talked about decentralization of this particular thing, because every family is unique, every child is unique. Shabina ma'am, would you like to add on to this?
Yeah. So as I was telling the other day, am I clear? Yeah. Yeah.
Yeah.
So yeah. So I think even professionals, students need training, just not how to handle the child, right? Also how to deal with parents, their concerns, their worries, their apprehensions, and the outcome of their participation or not participation. Because even if the parent says, I don't want to come inside the therapy room, I want to take a break outside, like if such a situation could be there, how the professional can give them the confidence that you can be a part of this journey with me in the session. Because as you know, the rehabilitative process is not a one-day process. It's going to be a long-term process. And giving the confidence, training to the therapist that yes, you are trained to deal with speech and hearing and sensory issues and academic issues for your child, but you are also going to be trained how to handle adult learning, how you're going to make your parent learn how to deal with the child and accept the situation and partner with this journey. So, if professionals or students, when they're getting trained, are going to get this input, how to understand the parent point of view, how to make them a part of your journey of rehabilitation of that particular child and make it successful, and what are the benefits. I'm sure most of the therapists will be more than willing to have open door and to make it easy for them, for the kids, and for themselves. And also the personal accountability, right? So parents usually feel my child is taken inside. I don't know what's happening. My child's not improving. I don't see any difference. And the therapist also feels like I worked so hard and I'm trying to do my best to bring in this skills in this child. And why this kind of parents' perception? So there is also kind of a barrier in the relationship between the parent and the therapist. But when you have the open door policy, you have that kind of, you see what I'm doing, right? You know what all the things I'm working with your child and how we did it and we achieved it. You saw it's your child who's performing, correct? In the session.
Mhm.
So that gives a kind of greater team spirit, teamwork, accountability, and definitely the safety issues is not even to be worried in either sides. When a parent is also not concerned or paranoid about the fact that something is going to happen to my child and associating things.
It's beautifully Shabina has said this. I mean, it's really nice because many times, sorry, I'm just talking out of turn, but
No, no.
just felt
Please
important
do.
to acknowledge this. Yeah, so important that we are not expecting one type of response from parent, but we are just like how we are with our family members. We are trying to facilitate each other at some point in different ways. It is just like that, and there is no fear around it. Once you are open to nurture a relationship with a family that you see, then you will try in whatever way to make it work. So
I think very
I'm also
beautifully
speaking
pointed
out
out
of
by
turn.
all three of you. Starting with Seema ma'am, I mean, the fight that has gone into bringing the law in Kerala, it's bringing out that experience of that fight is really, really amazing. And moving on to replicating into other states and bringing out the decentralization, like Sarah ma'am was talking about each family being unique. And then Shabina ma'am also adding on to it how, the practical approach of what a therapist learns at when they are getting educated, and how important it is to kill the barrier between or the thought of this being a transactional affair. So, I mean, we can move forward with that to our next section of basically a holistic approach and how it benefits. So, from examples, if our panelists can tell us, if with short examples, if you can, explain your experiences that how holistic approach has helped families and helped therapists and professionals as well. So, we'll actually start with Shabina ma'am maybe this time.
Yeah. Yeah. So I'm actually probably out of order, but here. Yeah. So yeah. So the family, there are many examples where I would say that working with the parent has partnership has made us kids go out of the session very soon. And that's been a very, very helpful thing. Like one example I think I was sharing the other day was that a child was, I showed the picture of a cookie and he was going on saying, cookie throw, and he was laughing. And the mother was there and she was laughing. And I said, what's the joke between both of you? Please share with me. The child wanted to communicate. The other day, mommy got angry and she threw the cookie, right? He just wanted to communicate to me, and that's all the vocabulary he had. So, and he just needed to tell me that. So, it was a wonderful experience for us to know that, her partnership with me and he wanted to communicate with me. So, it really helped us to make sure that we can bring some good improvement in the communication aspect of this child and help him to frame that sentence and experiences. And now the parent knows that this child wants to come and communicate all the nonsense that I've done at home, that I got angry also, he wants to tell Shabina ma'am. Okay, fine. So it's been that kind of a partnership with the parent. And definitely involving the father in the therapy sessions have been very helpful for us, because that way what will happen to us is that they take the responsibility to participate in the development. So I think that's what has been my takeaway in having an open door uh, policy happening here.
Actually, a very beautiful experience shared by Sabina ma'am. I mean, imagine for the caregivers and the professionals, imagine going through that experience, the child saying a cookie throw, and the professional not knowing the context behind it and how it might have turned out. Like, moving ahead with Seema ma'am, probably Shima ma'am was talking a lot about the purpose of therapy being to enhance the lifestyle of, enhance the quality of life of the entire family and not just the child. And also, like, child development is not happening in a vacuum. The environment, helps in all of those things. So maybe Seema ma'am can talk about that and how it is important to inculcate that.
Yeah, like Shabina said, and what Dr. Sana also said, every family is so different, so unique. And it's like starting all over again, learning about the child and the family, and creating that program together with whatever you're learning from the child and the mother. And maybe the mother has other issues, maybe two, three children, maybe financial struggles, marital issues, mental health issues, several other issues. Even the mother doesn't live in a vacuum, and the entire focus is not this one child for any woman or any family, right? So, like she rightly mentioned, many, many mothers are looking for respite. And therapy center can be a space where, like, okay, finally somebody else who knows I can trust, and my somebody else who can work with my child and my child loves them. So let me just sit down for 45 minutes is the reality and it is the truth. We are not denying that. Now then as professionals, one thing is to know, Are, what do we do if the driver is coming, dropping the child there and going? What do we do? Who do we get into the? These are things that happen. There are some mothers who come there because they form the bond. They all scoot for a ice cream outside, and all their children are in, because for them it's a safe space. It is a respite. Agreed. This is the reality. Now, what can we do as professionals is to think How come the mothers are not getting a respite in their own homes? What is going on there? Isn't our objective to see that if they are going to live the maximum time of their lives until the child is 18, a woman is living with the hope of a respite in a 45-minute therapy session? How are we improving her quality of life or the family's quality of life? So let's start thinking reverse, and all the professionals in the center. I'm presuming most therapy centers now have psychologists, speech pathologists, occupational behavior, many people. Or if they don't have, connect with them and create a protocol of how are you going to do this within you. What we saw here was forget the disjoint approach in the family with where you're only looking at the child, and I maybe as a special educator I will look at reading, and Shabina speech pathologist will look at vocabulary, stammering, stuttering, and even if I don't know what she's doing and she has no clue what I'm doing, and we are working in the same center expecting the mother to coordinate all this, it doesn't work. So I think uh, because we are the so-called subject experts, this needs to start with us, right? And like I was telling in the previous, the power hierarchy. The professional is seen as somebody who knows better. So it has to start from us, where we as professionals create. So how do we? How? Ask. So each family, each center is different. So that also needs to come with think what can be the protocol? How do we break this? There is this mothers who are super happy going there. What can we do? How can we engage them? Maybe another mother comes to this child, this mother goes to, I don't know. We have to create that. That's the professional's job. Create that unity, the collaboration with the professionals in the center. Otherwise, what happens is I can be a speech pathologist or special educator and the child doesn't fit. Oh, sitting tolerance, go to behavior therapy. Behavior therapist says, oh my God, the child is not understanding what I'm saying, or the poster is wrong, or whatever, and say, go to OT. Now, hello, professionals come together and figure out, learn, okay, this child is not sitting. Let the professional learn. How can I learn? That's also our duty as professionals, and not to shift the responsibility of the child not sitting with us to the mother to have learning. That is also lack of collaboration among professionals. So I think it should start there.
I think a very important points about bringing up a community of professionals where they share their experiences and learn from each other, and also very important point that you brought about mental health of mothers. Especially mothers are the primary caregivers, and shifting the whole responsibility most of the times on them, it becomes quite a difficult life. I mean, it's hard sometimes to even think about and empathize. So I would like Sana ma'am also to give her opinion and her experiences, talk with her experiences around this.
Yeah, one of the challenges also is that there is no time given for professionals also to be able to communicate and connect with each other, because
Right.
many times the idea is to move from one session to another, from one session to another, and so like you said, it becomes like a transactional thing where okay, हो गया session किया फिर next वैसे तो but that is the work will become meaningful only when there are opportunities for professionals to talk among each other, which brings me to think that at the center it is important to think about the time that goes into coordination and connecting with each other, and it should be given equal importance to the as the time which we give for sessions. This comes back to the mental health of professionals as well in many
Yeah,
ways, and it's only when both the mental health of the professionals and parents we are trying to support, and together only we can evolve into having policies that benefit the families. And we are talking about unique relationships with every family. Imagine, it's so hard to form unique relationships with every family with the limited time that you have. It means you really need to know them, and you need to have that trust with them that okay, today even if I'm not doing anything, I've done a lot because I came to know about you or you came to know about me, and that's a foundation for my next sessions or whatever we are planning in the future. So that time should be given accountability.
I mean, definitely, if we see the ratio of therapists or professionals that are there in our country, it's very skewed. So bringing in the mental health context of therapists as well, it becomes really important. I believe there should be like a platform where there is a collaboration approach, and maybe every caregiver and every professional could be incentivized to participate. I mean, I'm just brainstorming.
Yeah, we love brainstorming.
So let's move on to another section, which is learning and collaboration opportunities, as we were talking about that, so we can take it up next. The next pointer is basically how can therapists effectively guide parents in applying therapeutic strategies at home to improve the child's care and development. So at-home interventions, I believe it's quite important. So maybe Shabina ma'am, you can start with certain strategies that can be given for at-home interventions.
So mostly, I think we do is that we give reading material because now the parents who come at least to our center, most of them are very educated and they get a lot of information on Google. So they get a lot of information everywhere and they're confused. So having the right reading material is first of all very important for them to navigate through the whole idea. And then definitely we recommend Nayi Disha videos for them so that they will get their kind of guidance in that aspect, right? And those can be eye openers for most of the parents because they are confused. They are like, they have so many voices coming from everywhere. And then
Right.
it is to say that, yeah, and then we say that the strategies, if they are crisp and they are few and they are specific and they are organized and they are just to the level of what the child needs next. That's something we crystallize with their opinions as well, because mostly we do take the parent opinion of what do you want to see changed in your child in communication aspect the next 3 months. What do you want to see your child the next 3 months and when you think therapeutic aspect. So as they open up and they bring about their thought process, then we say, this is the capacity, this is the demand that we can place on your child, and this is how we can progress. This will be having a leveraging effect on your child. What do you say? That is when we collaborate and then we request for video follow-ups to be sent by the parents, which are very confidentially kept. And we request the parents to show the accountability and demonstrate in the sessions and encourage them and very gently show areas where they are not doing the right way, correct, and then very gently so that they learn it. I think it also comes from the adult learning principles that we can teach. We all are learning, and an adult can learn. They may not be in this field at all. They may be an IT professional, they may be in businesses, and they are, or an architect, and they are not at all into this profession. And there we incorporate this guidance to the strategies, which is what we have learned and we have to give them, and then they move forward. That's our experience.
Right, right. I would like Seema ma'am to also share her thoughts about how, caregivers also can share strategies with therapists, the other way around.
Yeah, certainly. Like how initially Shabina was giving an example of what happens at home, will somehow or the other will come to the center and we get to know most of it. And many a time when the parents are inside, it can be used as a venting ground to the therapist if there is a good trusted bond. They start telling everything about other issues that they face also, especially when the therapist has no clue what to do with all the information. In one way, it's great to have information, but what information, how much within that 45 minutes, it's very tricky, which is where the professional needs to have that training. Because if I am a special educator or a speech pathologist, then the mother is there, the child is already, I'm trying to focus, and the mother starts talking about what happened the previous night in the marriage, or it could be abuse. What am I supposed to do there? Do I turn around and become the psychologist, which I'm not trained, or what do I work with? So these are the tricky parts of, I mean, what I say as there can be barriers. So which is why all the more reason before we open this door, which is of course now a mandate. So there is no option of do we let them in or do we not? We have to. So then, like how Dr. Sana said, it is the responsibility of the center owner, and which was there. Like when I did my special education, which is the 90s, then we used to have 1 hour, which was called the child conference time, when all therapists would sit in a room and each day we are discussing one child and say, hey, this happened with me, this. So that is, I would say, oh, they said that there, and we would all, it used to be there. But now, when I see it here, that doesn't exist. It's like one after the other. True, probably because the number of children have increased. So then, isn't it all the more reason that we facilitate and train the mothers so they take on and we don't have to pack so many sessions for one child? It can be okay. This we have done today, and then come after 2 weeks, and like how Shabina suggested videos. Thanks to the pandemic, most parents are very good with WhatsApp and things like that. So sending the videos, but again, if the videos are coming, when are the professionals watching and reviewing these videos? In their work hours or in their homes? Then what happens to the mental health of professionals? So everything that we discussed, Ankur, is all connected to each other. We
Exactly.
cannot discuss this in disjointly either. So the therapy center owner or whoever is heading that that mindset, there is a hierarchy, right? So therapists are working under somebody else's protocol. That should change, and we tried that here. When that was resistant, that is when we went even further to the state to get the policy in place first. So then the center owners must see that you can't just get the therapists to do what they are not trained for doing or what they do not have the time for doing. So then it becomes mandatory. For that, professionals should speak up. And I'm so glad both of them are here today that this is coming out. Usually, I only sit and scream, and it's like, no, we need to listen to both sides. It is important.
Sanam, would you like to contribute to
No,
the
I think
discussion?
great points, and yeah, it is on how the tone comes from the top, and the goals from the top that set the you know ground for us to work in a nurturing manner.
Exactly. I mean, there's two things to this, I believe, from all the discussions that I am also learning a lot of things. There's two major things, I believe, the importance of community at the ground, which is very important. Community, not in silos, like professionals being in one silo and caregivers being in one silo, not like that, but community all together, coming together and discussing all of the importance, all of the things that are important to them. And something that comes from the top also, from the legalities and the frameworks and the policies, which we can think of, disability not being seen as a coming up economy. It's a very human thing. It should not be like the legalities and the framework should not, and the policy should not come up as a altogether another economy. So maybe
But
we can, yeah, yeah.
sorry, I just want to add here that, then it brings us to think about the point that we have to think about different models of care, different models of services. Because
Correct.
if it's only one-on-one therapy, then it may not always suffice because we don't have that much of support in our system at the moment.
Definitely. Yeah.
And we need to be creative then, like how Seema was saying that it's important to have opportunities for training, parent support. It's important, like how Shabina said, to have access to resources in a way that the parents can understand. But all
Mhm.
this does not mean that if you do something like this, it does not mean the child will not develop. It can still be better than what a one-on-one session can give you, in fact.
Correct. Yeah.
So uh, that recipe of which program for whom is different for every family and parent.
Mm-hmm. I guess all the pointers put on here has a lot of insights and a lot of knowledge. Maybe we can close the session with a very important topic, which is very taboo. Generally, we don't like to talk about, abuse that happens at centers or abuse that happens at homes also, certain point of times. So maybe we can talk about how caregivers, can be trained to understand early warning signs of abuse, or therapists can be made to understand the early warning signs of abuse. And, not just understand, but voicing out becomes really difficult sometimes, because it is such a taboo subject. Or maybe Seema ma'am can start with the discussion on this.
Yeah, one is to understand what is abuse. Next is, once we understand this is abusive, then what? What do we do with that knowledge?
What do we
Who do
do?
we
Yeah.
go to? How do we report? Where do we go? And if you are the professional who is paid by your employer, you need their permission, just like how it is in school. Now, something, the child comes and tells something, what happens at home. What power does a school teacher have to go? There are hierarchies. So abuse is common knowledge. Anything which is verbal, shouting, screaming. That is whether that is not specific to therapy center. So that is just abuse anywhere. Whether you're shouting, screaming at home, it's abuse for child abuse. Shouting, screaming in therapy center is also child abuse. So it doesn't make shouting, screaming, hitting the child any better when it is done by the parent at home. And it is not more abusive when it's done by the therapist in the center. So abuse is abuse. So one, verbal abuse, name calling, screaming in loud voice, basically the power hierarchy, physically hitting the child, causing injury to any body part, sexual abuse, which we have, touching the genital parts, making, when anything, and even showing pictures indicating that, or especially with professionals who might have to actually hold the child also, because if they are physiotherapists or occupational therapists where there is a need, you never know what the sensory stimulations of the child are, and also the age of the child. So there is no many children go home and imitate certain behaviors, and that's when the parent came to know. That's how we also came to know this was happening, when the child started imitating certain things. Now the child goes to different therapy centers. They are not even going to one therapy center. How is the parent going to say which therapy center, which professional, when, where, how, and the child doesn't speak, and we wouldn't know. So so abuse is abuse anywhere. Those are just general listed: verbal, physical, sexual, emotional. Like when the child is trying to say, "Chup, don't cry, stop it," that is also emotional abuse, not allowing the child to express. Psychological abuse: why are you thinking like that? Don't think like that. This is wrong. Your child makes a mistake while doing something which the therapist asks. Shaming the child, chi, buddhu ho, whatever. Now, unfortunately, we will think, oh my God, which are the therapists to do it? But unfortunately, we have seen it happening here from licensed professionals. So that, whether done at home by the parent or by the therapist, it is abuse itself. Now, the point is, again, what training do the professionals have on what to do? Suppose, like Shabina said in the beginning, to this time the child said cookie throw. What if the child said something else throw? What would she have done? Where will she go and report? Or if the child said "Mama hit me" or "Papa hit Mama," what will we do? As we know it's abuse, what do we do? So this, I think, next Nayi Disha needs to bring the therapy center owners here, and that is the community we need to build. We've had talks with parents. We've had with professionals. See, we are slowly going higher in hierarchy, and we see where the roadblock comes. I think that's an important discussion. How come? Why are the therapists packed with so many, one after the other? How does it benefit anybody? So yeah, abuse, that is also abuse for me. Abuse of the therapist and the therapy.
Right. I mean, this touches a very important aspect of safety. If Sana ma'am would like to, share her opinions on this.
I think Seema has said it all, but uh, it's just that we need to be aware of these things. It's a very complex web. It's not as simple as being able to report to a certain,
Yeah.
you know, uh, committee, because we don't have committees all the time. And again, it brings us back to having policies at the center level. Somewhere, if and these should be vocalized from the top to the organizational, whoever is part of the sorry, who's in the professional, all the professionals in the organization, all the team members, including the reception staff, the support staff, the admin staff, all of them need to be aware of the values that the center holds and the policies that we are standing by. And slowly it's changing. There are acts coming up. People are becoming more
Yeah, yeah.
aware of things, and this is moving towards good. Yeah.
Shabina ma'am, would you like to add on to this?
Yeah, I think abuse should not be tolerated anywhere. Any kind of abuse is intolerable for any human rights as such. So whether it's young, old, whether it is, and the perpetrators are there, they are very much there, and there are two ways to say preventable, then the healing process. Other thing is the monitoring process is also there. So we may have to consider preventive, then the monitoring that it doesn't happen, or the way that we can see if anything, any signs are seen or coming up, we can always take that into concern. And then the healing process, correct? And now, usually if there is an abuse, the parent, how bold are they to raise this issue, to address this issue? How cognitively they can look at that issue? Correct. So even if the child is having a urinary tract infection per se, the child is holding that place. Is the parent freaked out thinking that somebody has, abused my child? Correct. So to say it in a more pragmatic manner, definitely children with the kind of speech difficulty that they have, most of them have communication delays and speech difficulties. The visuals which could help them as a warning sign to say, this is not done, this is not to be done.
Correct.
Correct. Yeah. So the visual, in the sense of drawing, where they say, this is not done, so that the child can always pick that card and say, in times of concern, that this card is a danger card. Then the child, the people who are the adults who are around the child can be aware that maybe there is signs of abuse, and let's take a stand about it. Let's figure out where. And then the anonymity part of it, because many of the parents feel very much ashamed, just like any normal people right now, the general public feels, I'm abused, just to address the fact my child is abused. Or, they don't want to get that attention. They don't want to get into that zone where we want everybody to know.
Correct.
Correct.
Yeah.
That
Yeah.
anonymity, yeah. So all of that has to be considered, especially for children with special needs and with communication difficulty. We need to consider that preventive, monitoring, and healing process for the people who've gone through it and making it easy for them. So anybody else have to go through it, they'll say, you go through this process. You will come out of it. I've already been there and I'm willing to, help other people. This is the process. Come out of it. Something like that would be very helpful.
Right. So amazingly summed up the discussion by Shabina ma'am. I feel this, it just travels back. It just makes a circle about how open door policies are quite important. And it feeds on to how it feeds on to like child protection policies. Like if you are transparent, if you are sharing things, it not only helps the child's development by sharing the therapy interventions, it also helps, in the protection of the child from multiple abuse that could happen. And I guess it's a beautiful session that we had here. Amazing insights. There are a few questions from parents. Let's just take them up to sum up the session. We'll start with a question by Saroj Singh. And she's asking probably, मैम मैं अपने बच्चे का 1.5 ईयर से थेरेपी करा रहा हूँ पर ज्यादा चेंज नहीं आया है बच्चे में, क्या करूँ? This is not exactly related to CPP or ODP, or it could be. It definitely could be. Sharing of experiences. So they want the answer in Hindi. If somebody can explain from the panelists in Hindi. Sana ma'am, would you like to?
Yeah. No, I'm just trying to think how do we fit this into the context of what we are talking.
Mhm.
हाँ, ओके। सो आपका सवाल ये है कि बच्चा 1 साल से ज्यादा अभी थेरेपी ले रहा है मगर इम्प्रूवमेंट नहीं देख रहे हैं आप, तो बहुत सारे कारण हो सकते हैं, मगर ये डेफिनेटली आपको जानना इम्पोर्टेंट है कि हर बच्चा प्रोग्रेस करेगा। अगर प्रोग्रेस नहीं कर रहा है तो हमें देखना पड़ेगा कि क्यों नहीं कर रहा है, एंड वो समय लेकर आपको देखना पड़ेगा। शायद आप क्या चल रहा है बच्चे के सुबह से लेकर शाम तक, क्या क्या हो रहा है, सिखाया क्या जा रहा है, क्यों नहीं सीख रहा है, क्या बच्चा मानसिक तरीके से जुड़ा हुआ है, जो भी सेशंस हो रहे हैं उसमें क्या कंफर्टेबल है, क्या अच्छा लग रहा है उसको सीखना, क्योंकि जो भी सीखना होता है वो जब बच्चे कंफर्टेबल है, जब हैप्पी है, तब अच्छे से सीखते हैं। या कभी-कभी सीखना इसीलिए भी नहीं होता क्योंकि जो वो सीख रहे हैं शायद वो रेडी नहीं है वो लेवल के स्किल्स के लिए। इसका ये मतलब है कि शायद हमें फिर से देखना पड़ेगा कि बच्चा अभी क्या कर पा रहा है और हमें क्या चूज करना है। ऐसे ये स्किल बेस्ड भी देखना है, और कुछ और चीज है क्या जो बच्चा, जिसकी वजह से बच्चे आगे नहीं कर रहे हैं क्या, कनेक्टिविटी में या इंटरैक्शन में कोई मुसीबत है, ये सभी भी आपको देखना पड़ेगा। या एंड देयर आर मच मोर। सो अब ये सवाल का जवाब मैं एक या दो लाइन में नहीं दे सकती हूँ, मगर इम्पोर्टेंट चीज ये है कि नहीं सीख रहा है, ये इम्पोर्टेंट चीज आपने नोट किया, ये बहुत अच्छी बात है। या
Right. So moving on to the next question. Hello everyone. My son has Down syndrome. He's 17 years old. At present, he faced so many challenges such as hand flapping, and sometimes he's deep into his thoughts. How can I help him? Would anyone like to take up the question? Sabrina ma'am, Seema ma'am, Sana ma'am, you can too.
then
Sabrina,
So where is he placed?
Uh,
Yeah. So where exactly are you placed, and do you have any vocational center close by? So he
hmm,
needs a job. He needs something to occupy his mind. He needs something to keep himself productive, useful, and have that sense of, achievement. डिपेंडिंग अपॉन उसका आईक्यू के अनुसार एंड उसका इंटरेस्ट के अनुसार, you have to find something that he can be productively involved vocationally. That will be my suggestion,
right.
because then he will not be the flapping is usually a sensory seeking also, so he will be directed towards something productive and useful. He's almost a 17 year old young man, so that would be helpful. Anybody else want to contribute?
So here's a question about speech of the child of Purva ma'am. She's asking anything about speech clarity. My child has just 60% clarity. So any exercise or Ayurvedic treatment for his speech can be cleared.
Yeah, I think I can only answer this part. Yeah. So if there is 60% clarity, that means there is a possibility that 40% can be achieved. So first, we have to figure out what are the errors, what are the sound systems which are affected, what are the phonological errors, PHONO GICAL errors. So you can Google on that phonological errors, and based upon the phonological errors, we'll have to target sound by sound and error by error. Phonological errors are called simplification errors, which we also did when we were small. My daughter used to call for deliberately, she used to call deli belly. because, and for chadar, she used to call chulu. So that is now become chadar is in our house has become chulu only. So they are phonological errors, they are simplification errors. And when you see the phonological errors, examples, you will find that your child may have that. That's why 60% is there, correct? But 40%, if we work on it with the different examples and target the error by error, you will be able to get it.
Right. I guess all the questions are over from the parents. I believe the questions were not around open door policies and child protection policy, but I believe this discussion is all the more important to be, discussed with parents and moved ahead. So thank you so much, Seema ma'am, Shabina ma'am, and Sana ma'am. Amazing
Thank
insights that brought out, especially the insights regarding how therapists and the caregivers should form like a community and learn from each other. And there should be definitely there should be a platform, and more than that, there should be a legality framework that is going on. It will move like a wildfire, we hope, in multiple other states. And it comes from an empathetic point of view, and um, we hope that it does not question anybody's intent, right? Towards open door policy, it is more about learning from each other. So thank you again, everyone. If any of the parents who are listening, if you have any questions, you can reach out to our free helpline at 844-844-8996, and you can reach out to all of the professionals. We will share the links and mail IDs for you to reach out to them. Thank you so much for joining us. Hope you all have a very good evening. Thank you.
Thank you.
Thank you.